This is Steve Vinson. You're about to experience the life science effect. Hello, aspiring leaders. Welcome to another episode of the Life Science Effect, where we work to answer the question, what does it take for me to be an effective leader in the field of life sciences? Each week, we will talk to the best in the business to answer your questions about what it takes to be a leader in life sciences. The good, the bad, and the ugly. And always be asking yourself, what effect will you cause? Hello, and I'm Steve Vinson, and I'm talking about my new podcast, The Life Science Effect, which you can find at thelifescienceeffect.libsyn.com. I have been doing it for about a month, and I have 3 episodes out, and I never did an episode 0. And I was listening to a podcast about podcasts, and they said, well, you should always have an episode 0 just to tell people what your thing is all about. And give them an idea of what's coming up. Well, the other thing, somebody asked the question, well, what if you've already started your podcast and maybe it's a little different than what you thought it was going to be? And so I thought after 3 episodes, that's kind of me. And the host of that podcast show about podcasts said, absolutely, you should go ahead and do another episode 0. Or if you haven't already done one, do your episode 0. So I thought I'd try something a little clever. I don't know how clever it'll turn out to be, but I thought I'd do a Facebook Live and also record. I've got my recording going here, and I will drive my editor, Paul Schultz, nuts when I send this off to him and ask him to edit up an episode 0. So one of the first things I noticed is that getting guests is not that hard, but getting them scheduled in, it takes time. So the first 3 took me a while to get scheduled. And then I thought, well, I'll release it. But I went ahead and I recorded them and then released them 1 per week. And I thought for sure I can get another guest within 3 weeks. Well, I did. I got plenty of people agreeing, but everybody wanted to schedule a month out or 2 months out. So this is what gives me the opportunity now to do, an episode 0, sort of meta with you guys a little bit. Or as my friend Uncle Carl likes to say, growth. So first of all, what's this show about? For those of you just tuning in, maybe you stumbled on this, maybe a friend of yours, maybe a guest that was on the show. Here's what we're aiming to do. The life science industry, as you may have heard, is continuing to grow like crazy. When I say life science industry, I mean pharmaceuticals, biotech, medical devices, maybe even agricultural technology, ag sciences. Is what that's called. It's an industry of particular kinds of professionals, things like working with regulatory bodies, understanding chemistry, understanding biology, understanding the science behind things. So it's a pretty good niche of people to talk to. The thing that I've noticed is you can go to events, you can go to networking things, but bringing people together is something that I think is a need. And since podcasting is becoming more and more popular, I think a podcast that aims to connect people in the industry as well as to promote the idea of leadership in life sciences and, inspire people. So what do? We go out and we find leaders, people who have already had some success in life science, and we interview them and ask them their philosophy on leadership. And we asked for their advice. So far, we've had our very first guest was Kristen Jones of the Indiana Health Industry Forum, and she's the CEO and president of that. And I thought that would be a great place to start for 2 reasons. And it turned out to be true, both reasons. One was she's very engaging and very motivational. And that's kind of what the Indiana Health Industry Forum is about motivating, inspiring, and connecting people in our industry to help make make new drugs, make new medical devices, a lot of startup activity going on and working with the corporate companies. So she talked a lot about that. We talked about her leadership approach, which is different for her maybe than a lot of people because she's in a nonprofit trade organization as opposed to a company that discovers and manufactures things. So it was really interesting to get to know her a little bit better in that conversation. And then in episode 2, we had Valita Fredlin, who is the general counsel and the chief privacy officer at the Indiana Health Information Exchange. And with everything going on with Facebook and Zuckerberg testifying before Congress and everything, that all happened after I'd already talked to Valita. I know Valita because she's a parent where my kids go to school. So a fellow parent of daughters. And so she was more than happy just based on knowing me to be on the show. And it was a great one. If you haven't heard it, go check it out because everything in the show, even though all this Zuckerberg stuff hadn't happened yet, it's what she's passionate about. The privacy of data, treating data ethically and treating people ethically, and knowing that people should have a say over what happens with their data. And so it was a great conversation, very topical, very timely. And Valita's just a delightful person. We even talked a little bit about what it means to be a parent of daughters and what that means for trying to raise daughters to be strong leaders. And my buddy Woody, who's watching the live episode, I know he and I have traded conversations online about raising daughters and wanting them to be strong, independent women. And it's a challenge. And so we talked about that in episode 2. So go check that out. And then my third one was a completely different person, different type of person than either Valita or Kristen. It was Rajesh Periyanayagan. And he ditched his corporate job and went out to start his own startup, which is a bioinformatics company that helps microbiologists keep track of tons and tons of data that they get. And a lot of it's image data, which if you're in IT or you do anything with data, you know, image data is huge. And to search through that manually just takes forever. And you would rather have your microbiologist solving difficult problems than surfing through mounds of data. So he started a company called Carriosoft to build software specifically to help those scientists get through their work faster so that they can discover ways to make us healthier and less sick, let's say. And he's a fascinating guy. It was very fun talking to him. As much as I've always been a small business person, I've never taken quite that kind of risk where you go out and you don't have income on day one. And what you need to do is go from R&D to revenue as quickly as possible, or go out and find venture capital or angel funding or seed funding, which he is on the ultimate seed fund, the ultimate angel fund right now. He's using his own savings. So I think that's pretty cool because that means you really believe in your product, right? If you're willing to pay out of your own pocket to get your business going. And if you can get your family on board with that, then you stand a chance of being successful. So this is what it's about. It's about inspiring leaders, and it's about motivating people, and it's about connecting people. The connecting piece is really important to me. I mean, you can go, I just went to a panel discussion the other day and I learned quite a bit from the panelists, but it was in this big room. They fed us lunch. We ate lunch, which is great. Free food is always good. We ate lunch and we all sat at our tables and listened to these panelists speak. We got to write our questions down on little index cards and hand them in. And the leader of the thing asked the questions of the panelists, and then it ended and the panelists kind of stood up there and people crowded around them to meet them. A couple of them are going to be on the show. I can tell you that. But again, a month or two out, but you know, there's no interaction really. Everybody goes back to work after lunch. What I'm trying to do here, even though this medium is kind of a one-way medium where I just kind of talk with the other person and then it goes out into the ether, I want to try to connect people. If you resonate, if something resonates with you, with a CEO that I interview or a vice president, and maybe you're a little shy to try to get access to these people, or maybe it's just hard because they're so busy and maybe you don't have time to go to these networking events, but you get to hear some advice that this CEO who's had some success, you get to hear their advice and it resonates with you. And man, you'd really like to be able to connect with them. I'm your guy. I'm going to go meet all these people. If I do a show a week, taking a week here and there off, I'll do 45, 50 shows a year. That's 45 or 50 people who've had a ton of success. They're CEOs, they're VPs, some directors, entrepreneurs, people that started their own company. So yeah, you'll reach out to me and I'll connect you guys. My friend Lou Begnell, who was also, I saw he was watching the video. When I first met him, I knew really quick that that's the kind of guy he wants to be. He wants to connect people and he does. He's introduced, I think if he were a matchmaker, he would be responsible for more kids than Genghis Khan, but he's not a matchmaker in that sense. Sorry, Lou. Didn't mean to embarrass you there. But since I know Lou, you know Lou, which means if you want to meet somebody, you can contact me and I'll talk to Lou. If I haven't interviewed the person or I don't know the person, I'll have Lou introduce you. Anyway, my point is, leadership is one of my passions, and leadership is about relationships and it's about connection. And that's what I want this show to be. I want it to be, something that attracts people to the business and to these other people. All right. So who do I have coming up in a few weeks? I keep promising, hey, I may not have had a guest this week, but I've got some coming up, and I do. A few have confirmed and one or two have even scheduled. So starting, next week, I'll record it next week. So it may take some time. I can't throw Paul under the bus. He also edits the, Don't Panic radio show, which is our comedy show that we do once a week. So I don't want to kill him, to try to get this one out, but Monday or Tuesday, I'll be interviewing, the leader of a startup. It's a services company. So he provides management services to other startups and to large, corporations. So he does leadership for a living. He sells leadership for a living. I know him pretty well. I think it'll be an interesting conversation. Also, we will have the CEO of a large institute here in Indianapolis. I'm not going to say his name just yet, even though he's on my calendar. He's a pretty busy guy, one of those high-powered people that's just always flying around the country to meet people and stuff. But he's responsible for millions of dollars in corporate and government grants to push life sciences forward in Indiana. So I will announce that in a couple of weeks. And then there is the president of a global quality service company. Now she has confirmed, but we haven't scheduled, but it's probably going to be mid to late May. And she provides compliance services to, again, large corporations that you've probably heard of, as well as startups and entrepreneurs. And she's also, she's the president of this company. She's built it herself, and she is a strong advocate for women in leadership. So I'm looking forward to that conversation. I haven't found out if she has daughters, but if she does, maybe we'll talk about that again. But she's going to be great. Then we have another CEO. This one is, he's a CEO of a multinational startup. So the way startups work, as my friend, H.J. Lacey once said, he's like, what do you call those companies that they don't make anything, but they want your money? I said, startup? He's like, yeah, startup. So this guy's the president and the CEO of one of these companies. But they're pretty far along. You know, they've gotten several rounds of venture capital, tens of millions of dollars. They have a technology that is going to turn them into a even larger company, and they're going to sell for $1 bazillion, as far as I know. But he's going to be fascinating because not only does he do that, but he also has been an executive, like C-level executive, VP, C-level executive at large pharmaceutical companies that you've heard of. especially if you live in Indianapolis. There's a large one here that he has been an executive at. And so I'm looking forward to that one. He was a speaker at the panel the other day. I believe we'll get another episode out next week with the president of the consulting firm. It'll probably be late next week. But after that, I think we'll be back on our regular schedule. If not, I was talking with one of my colleagues at BPM, with BPM Associates, which is our presenting sponsor, as you know, if you've heard the show. And he had a great idea, which was just get the people of BPM, and we're all just regular guys, maybe get a growler of beer and a few pint glasses and just sit around and talk. And there will only be 2 rules. 1, keep it clean, because I don't want to have to flip that explicit switch in iTunes. And 2, talk about work. So we're not just going to be sitting around shooting the breeze. We will be talking about work, our philosophies on leadership, and it'll be other voices besides my own. I think that'll be pretty interesting. So we'll see how that goes. That may be the next one. So the week after next. And then after that, I start like one after the other doing these other CEOs and presidents that I just told you about. So that's what the show is. That's who's going to be on the show. I'm excited about the prospect. All the feedback has been great. You can get us on Spotify now. You can get us on Apple Podcasts is probably the best. That's what I use. It's not a great app, but that's where they have like 65% of the podcasting market. All you have to do is search for the life science effect. I tried it. A couple of friends have tried it. We're one of the first ones that come up. Well, we are the first one that comes up if you put in the life science effect in any of those apps. Okay. Or you can go to thelifescienceeffect.libsyn, LIBSYN.com. And that's got all the links. Or you can go to YouTube. You can go to my YouTube channel and, they're going up there and I'm just amazed at the response we're getting on YouTube. So it took us, on my other podcast, it probably took us 6 to 8 months to get up to a dozen listeners. And, now we're in the dozens. But this one, we've already had, over 100 downloads of our show, if you add up all the episodes. So there is a desire for this show. There's a need for it. I'm happy and delighted to be the one providing the service. And tell your friends, because honestly, the way that this show will grow and we'll get even more high-powered guests and we'll connect even more people is if you give us a rating on iTunes or YouTube or wherever you listen. And if you tell a friend, hey, go listen to this cool show. He's talking to some really interesting people. Appreciate you listening. Appreciate you watching. Thank you guys. And we'll catch you on the flip side. A very special thanks to our first sponsor this week. It's the Indiana Health Industry Forum. IHIF is a statewide trade association representing Indiana's health science business community. That's good. The diverse members of the Indiana Health Industry Forum generate the collective voice of the state's health and life science industry. Their mission is to connect key stakeholders to enhance business networks, advocate for member interests, develop workforce skills, and provide strategic vision in the interest of growing the state's health industry, economy, and reputation. Please take a look at their site for more information. It's ihif.org, and you can learn about how they serve members across Indiana. Their leadership members include companies like Lilly, Cook, IU Health, and some other sponsors of theirs are Roche and Fort Wayne Metals. So please check out ihif.org and check out their sponsors. And thank you so much to Kristen Jones, their fabulous CEO and president. And also thanks to IHIF. Now back to the show. Okay. I ended the live video, but then I had just a few other things I wanted to mention. That was a fun. If you didn't know, everything you heard up till now except, that had the sound that had me talking, was live on Facebook, in case you missed it. And that was pretty fun. Probably sounds better now because Paul's had a chance to do the editing, and he always makes me sound better. I wish he could just follow me around. You remember that scene from that one movie where a guy had just like a funk band following him around, just playing funk music, and it was like his background music? I need Paul to follow me around and do nothing but play cool sound bites and make me sound better. So great. That sounded better. And now you're getting this bonus material, which is what I thought of is I have a pretty standard set of questions that I ask the guests. And I thought it's only fair for me to answer the questions. I'm going to go through them pretty quick. I wanted it to be kind of short as an episode 0. But this will give you an idea of the general flow of the show and kind of how it goes. And you'll get to hear some of my answers to these questions. So for example, why pharma or biotech or medical device? What inspired you to get into this business in the first place? And what motivates you to keep going? If I'm answering honestly, which I almost always do, I have a chemical engineering degree out of Rose-Hulman Institute of Technology, and Eli Lilly hired me. If some other company had hired me, I'd probably be in that industry. So it's just as simple as that. Eli Lilly hired me. That got me in pharmaceuticals. But more importantly, now that I'm not some 22-year-old kid that just wants to make money, I'm an almost 50-year-old man that just wants to make money. But no, seriously. The reason I'm in it now really is, and it's going to sound a little bit corny, but what we do really does help people. It makes people who were sick well again. It helps extend people's lives. It helps relieve them of pain. There's just a lot that this industry does that's good and you can feel really good about. The other thing is a lot of smart people. It's so fun to work with people who really know their stuff and really care about people. So when you get to work with a nurse or a doctor or a med tech or somebody like that, these are people that got into this industry for a very specific reason, right? The next one is when you're choosing leaders to work with, how do you decide? What are the most important characteristics of the leaders in your organization? My answer to this would be transparency, openness, and confidence. If somebody comes in with these three things, some level of confidence tempered by humility, of course. If somebody comes in with confidence and transparency, I can teach them everything else they need to know. But when you're leading people, you need to be ready to own. That's the other one I should say. Ownership. That's huge. I mean, in fact, that may be more important than the other ones. If you could come in with ownership, knowing that you own your decisions and you own the fact that you are there to serve people, then I think you're going to be a huge success. What project sticks out in your mind as one of your greatest successes, and how did your leadership play a role in that success? It's the implementation of software in a clinical laboratory. It was a huge success. We got it done on time, under budget. But more importantly, we made the med techs, the medical technicians who run the equipment, we made their life so much easier. And they were now able to focus on higher level problems. We put in software and robotics that did the mundane stuff for them, so that they could focus on the hard cases. If your blood's normal or it's abnormal, but it's abnormal in a very normal way, the software could tell that, and it can move your sample around and take care of all those mundane tasks to free up the professional, the expert, to go, oh, wait, the software kicked this one out as being abnormal in a really abnormal way. I better go and use my years of training and expertise to figure out what's going on with this patient. In my leadership, it was all about the team, and it was all about empowering them. I was there to make sure they had what they needed to be successful. Whatever that means. I mean, sometimes that just means getting out of their way and letting them do their thing. Sometimes it means helping them resolve issues. Sometimes it means identifying obstacles, isolating obstacles, and removing them for them. So getting me out of the way is important. Getting other things out of their way is important too. People are smart. People know what to do. If they don't know what to do, it's very important to help them figure out what to do. And once you do that, get out of their way. The lead follower, get out of the way. Maybe it should just be get out of the way. Oh, how about the horror story? What project do you remember as a colossal pain in the neck, and what did you learn? This was earlier in my career. It's during my brief stint outside of the pharmaceutical industry and medical device industry. Maybe that's a lesson. What happened there is I had come from Eli Lilly, and I went to a small company where money was much more tight. So in my formative years of managing projects, I didn't fully realize that sometimes schedule drives a project, sometimes scope drives a project, and sometimes timeline drives a project. They're all important. Timeline, scope, schedule, budget. It's what project managers learn, and we learn risk and quality as well. But we learn about balancing the scope, schedule, and budget. Well, on some projects, timeline's a priority. It has to be done by X date, even if we have to spend more money. That was almost every project I did in my first 4 or 5 years of managing projects. Well, at this new company, money was more important. They would rather have a project be late if something came up than overspend the budget. Well, something came up. It had me up until 4 a.m. one night with a whole crew of workers trying to put in this large glass-lined chemical reactor. And it didn't fit like it was supposed to. The engineers had made a mistake in their calculations. And so we had to do a lot of modifications. Well, I kept the crew on that night so that we could finish that night to keep the project and production on schedule. Well, that's super expensive. And I overran the project budget by probably 50% because of that one night of having all these highly paid union workers stay until 3, 4 in the morning. They were probably making quadruple time by the time they were done. What I learned is understand the constraints of your project, understand the priorities of your executives when you're leading a project. And if something does come up, things will come up. It's okay to stop, take a breath, contact your supervision, your mentors, your people who've been there before, and just ask them, what would you do in this case? I've run into this weird thing, and what do we do? Instead of trying to always be a hero. You know what? We're pretty far into this. I'm going to go ahead and wrap it up here. I have the rapid fire round, but I don't need to do that right now. So check out an episode. You get to hear what the rapid fire round sounds like. I think this is enough for an episode 0. So really this time, I'm not kidding. I'm really going to wrap this up. Thanks to my sponsor, my presenting sponsor, BPM Associates. What effect will you cause? And thanks to our sponsor, Indiana Health Industry Forum. Thank you to our listeners, and thank you to our guests, Rajesh from Carriosoft, Kristen from IHIF, and Valita from IHIE. Thank you so much. My name is Steve Vinson. This has been The Life Science Effect. What effect will you cause? You have just experienced The Life Science Effect. If you liked it, be sure and leave us a review on Apple Podcasts. And more importantly, tell your colleagues, your boss, your friends. It'll make you look smart. Maybe it'll even get you a raise. Thanks again to our presenting sponsor, BPM Associates. Set your medical innovations in motion. BPM helps life sciences companies design, manage, and execute their most complex projects. What effect will you cause? And thanks to today's guest. Let us know who else I should be talking to. Send me an email at steven.vinson@bpm-associates.com. That's all for now. Thanks for listening. Now go make something wonderful happen.